I think the potential for growth and advancement is really exciting. There's always certifications that you can go after, there's trainings, continuing education.
Because of the cross-training, the encouragement, and just like the education provided here, I've kind of have had my foot in a lot of doors. And so now I'm going back to nursing school. And I definitely wouldn't have thought of that if it hadn't been for my RAMC family and the coworkers that I work with.
I learn from my peers. And when they need something and they don't have the time to do it, I jump in. I don't know the stuff that other people do know, but I learn as I go along. And I've learned that in all the years that I've been here. So I challenge myself every day.
I just absolutely love the number of employees that have come into our organization at maybe an entry-level position, or they've just wanted to see what Reedsburg Area Medical Center is about, or they just want to get their foot in the door. And then once they start working here, they realize, maybe I want to try out this different department. You know, for example, we had an employee that started in our organization over 47 years ago. And this employee started in our nutrition and culinary services department. And soon after she was here, she had an opportunity to advance or to move into a patient registration role. While she was working in that position, she realized that patient care was where she wanted to be and where her heart was. And that employee went on to become a CNA. They later went on to nursing school and had then decided that they wanted to become a nurse practitioner, and is a nurse practitioner and midwife in our organization. And like I said, she's been here for 47 years. So that to me is just a very, very cool, a very, very amazing story of someone that started in our organization here and has been able to advance over the years and really grow their career.
I feel like the organization really emphasizes the importance of providing safe care, and through our education department we're able to maximize on that. We're unique in what we're able to offer in our education center, and the mannequins and simulation that we're able to provide to give the most real-life experience away from the bedside, to then transition for our staff to get to the bedside and provide that care.
And we give opportunities to staff here in our facility that others don't have the ability to give based on the lack of equipment or whatnot. So if there's a scenario you want to work on clinically, you just reach out and we will make sure that we have the correct equipment that you'll see at the bedside, the correct algorithm, all of the evidence-based best practices, and we'll go through that until you're ultimately as comfortable as you want to be. So when you walk up to that patient, you've had an opportunity to work out those bugs, ask yourself those questions, and you feel as confident and competent as you possibly can be.
People think rural hospital, nothing happens. But we see so many different things, and you take care of so many different things too, that you get to have a broad spectrum of knowledge because you're taking care of a broad spectrum of patients. When you can use everything you went to school for, that's really important.
You get to use it all. Everything that you learned in school, you get to use it all in our department. It's pretty amazing. I feel like it's very rewarding.
Yeah, because I know that's not how it is in a lot of other places.